Bismillahirrahmanirrahim. Assalamu alaikum, all of you. This is Farooq Siddiq presenting you today's lecture, which is on postures. So, today's objective are by the end of the session, participants will be able to explain the importance of proper posture, recognize the techniques for maintaining good postures, and they can raise awareness about the health risk of bad postures. So in the starting, you can see the image in which we usually sit in these positions on our workstations during working hours. So they might be affect the body and the upper back and the lower back and the neck region. They can lead to the musculoskeletal disorders. So, first of all, I would like to define the term posture. Posture is defined as the position in which one holds the body when standing or sitting. Uh, Anything or any position of the body can be a posture. Uh, it can be in the running and while sitting, while walking. They all are in comes under the term in postures. So there are two types of postures: poor postures and good postures. Poor or bad posture uh, are the position of the body that causes strains over muscles and ligaments and joints of the body. And in good postures, there are least strain or stress over supporting muscles and ligaments during movement or at rest. So, what are the factors that contributes in the bad position of an person? That are prolonged computer usage, and that can be poorly designed workstations, those workstations which are not ergonomically designed, fixed posture while working. We usually sit for longer period of time for several hours and without changing our position. So, and inadequate rest breaks. So we usually don't take breaks while working in the office environment. So, effects of bad postures. Number one is breathing by compressing lungs. Number two is it can raise the blood pressure, it stresses our heart, and it can slow down the digestion process. The muscle strain can be a reason of bad posture, and disc herniation is also can be a reason of bad posture, and nerve compression can be possible in bad posture patients. So here is an image on the right side of the slide. You can see the rounded shoulders of on the body and its effects. So rounded shoulder affect the upper back curvature and neck curvature. It can cause neck pain and headaches. Uh, the upper trapezius level or an upper neck region can be fatigued. The mobility of the shoulder can be compromised, and it can compress the lungs, heart. They can weaken the lower back muscles or glutes. Breathing difficulties and digestive issues are present usually in bad posture patients, and they can also affect the walking pattern of the patient. So, office health hazards. Well, it also called office syndrome. It can cause eye hyperemia, headache, shoulder pain, backache, neck pain, and carpal tunnel syndrome, especially to those who don't use a keyboard in proper position. And the wrist position must be in neutral. So in this image, you can see the bad posture with a cross and the good posture with a tick mark. And in the bad position, the person is sitting and forward leaning towards the screen of the monitor, and the angle between the screen is not appropriate. The angles at the hip and the knee are not are more is actually more than 90 degrees, and flat feet are not flat on the floor, and back is not resting with the back seat. So in the right side of the image, you can see the viewing distance is proper and wrist angle is 20 degrees, sitting back angle is 90-degree, knee is at 90-degree angle, and feet on the floor. So bad habits on working stations. We usually receive phone calls while working on computers, and we receive phone calls in this manner. There you can see the bad position while receiving phone. The lateral flexion of the neck is impacting the lower spine and the cervical spine, and it can cause the serious upper muscular region muscles problem. And on the left side you can see the right and position of receiving phone, and on the right side image the person is using mobile phone with a bent neck, and it can impact the upper trapezius muscle and the neck region muscles. It can cause the upper back problems and the neck problems. So this is the proper upright posture for sitting and using mobile phones or working on the workstations. Wallets are the main reason and plays important role in in piriformis syndrome, and it can also cause the lateral shifting of spine, which is scoliosis, and it also impact the sciatic nerve, and sciatica are can be possible in the persons who carries wallet like this. So good work ergonomics prevent neck pain, and this is a proper criteria of a and good workstation and ergonomically well designed workstation. So the top of your screen should be at the eye level. Make sure your shoulders are relaxed. Chair should be completely support the thigh. Your legs should be bent at 90 degrees and feet should be flat on the floor. Chair should have a backrest and supports your lower back also. And your forearms should be on the armrest and parallel to the floor. Keyboard, how to use keyboard, this is very important. In these images you can see the proper way of using keyboards, and the wrong ways of using keyboard that can cause carpal tunnel syndrome, which should be avoidable, and tight elbow angle should be avoidable, should be avoided, and avoid the wrist bend upward or downward. Avoid pressure on the elbow or wrist also. Proper posture for sitting. Well, switching your position or sitting position is very important while sitting, and usually when we work on the workstation, we sit for some hours continuously, and we should take proper breaks and in between and change the position of the body, and we should get out of the chair and take brief walks around the desk, and gently stretch. We can gently stretch our muscles while working and sitting on the workstation, and do not cross or relax. Keep your feet on the floor. Ankle should be in neutral position, and flat should be feet should be flat on the floor, and make sure that your shoulders are relaxed, and keeping your elbows in close to your body, and make sure that your back is fully supported while sitting in, and make sure that your thighs and hips are supported and at 90-degree angle. This is another image of good and bad posture comparison. In the good posture image, on the right side, You can see the angles between hip and knee. The viewing angle while reading is proper, and the table height and the chair height is ergonomically well designed workstation. And the chair height should be 40 to 50 centimeter, and the table height can be 60 to 75 centimeter, as per the ergonomically designed workstations. Well, common mistakes we make while sitting. These are the examples of that: forward leaning, or half lying, or half sitting position. Our sitting should be in straight upright posture. While driving, we usually sit in a forward leaning position that can impact uh, our spine and cause different musculoskeletal problems in the upper back region and the lower back region and the neck region also. Use of proper pillow is very important while sleeping. In the image, you can see the wrong way of putting pillows under your head, and this is the right way of taking pillows while sleeping. Lifting heavy weights. So this is the proper uh, description of lifting any kind of weight. So in number one, you have to get close to the object, and gloves may improve the grip, ensure loads are light weighted, avoid lifting from the floor, bend at the waist and use both hands, have a good grip on the object you're lifting, keep close to the body, push up with the legs, and use forearms and thighs to press load. And in the end, get help if needed, keep it tucked in, and pivot with your feet, not your back. The correct posture while standing is a stand up straight and tall. Keep your shoulders back. Put your maximum weight on the heel and keep your heel level. Let your arm hang down naturally at your sides. Keep your feet about shoulders width apart. And here is the image also, in which you can see the correct posture and incorrect posture. So, what we can do on the workstations or while sitting on the chair, we can do these stretches. In number one position, you can do the stretches for the upper limb in flexion position, and number two, you can hold this position for 10 to 15 seconds. You can get out from the chair and do these stretches of lateral flexion towards both sides, right and left, and for 8 to 10 seconds आप उसमें hold करा सकते हैं side. Thank you very much. That's all from my side, and thank you everyone. So in the end, I would like to summarize our today's lecture, in which we have learned the effects of bad posture and what they can cause in our musculoskeletal systems, and we actually get familiar with the bad habits or realize the bad habits or on the workstations, and we identify the desk stretches which we can do on the workstations while working in the office environment. Thank you, all of you.